Thanks, Tracy. Thanks for having me. So, Our Health in Our Hands was an initiative from the ANU, so pretty similar to the flagship. We got the mandate to do something big. And basically, I wrote it here, empowering lives through innovation and collaboration. Our Health in Our Hands, or short Ohio, is on a mission to transform healthcare for those with chronic conditions. As you can see, it's a huge task, and obviously it's not me doing this. I am just a lab rat, but it's many people, and I would like to acknowledge them through these pictures. It starts with our students involved with this, technicians, administrators, of course, other academics, our advisory boards, and last but not least, our people with lived experience who are incorporated in all levels of this program. So these are our core disciplines. How we set up. So basically we have 4 different programs, one on genomics and bioinformatics, one on big data. I'm sorry for the slide, it's very bright. It's very hard to read. It was better on the small screen. Then we have in green here, biomarker discovery and monitoring devices. So there's all engineers working in there. And then very important program 4, our health experience, led by Associate Professor Jane Despra, who basically connects all these bits. And what we're doing is we're looking for non-invasive or minimally invasive ways to manage chronic autoimmune conditions such as MS. And you see me here with my other 2 co-leads in that portfolio, and type 1 diabetes. We're supported by a scientific advisory board with lots of people who bring in these subject matter expertise, including 2 people with lived experience, Matthew Rogers and Dr. Mary Webb, who both live with MS. And our health experience advisory board. So similar to the to the setup you have here at the flagship, these people all have real life experience, either living with MS or diabetes, or having family members, or are part of major funding and advocacy bodies. I would like to give you a couple of examples how we do our co-design. We call it co-design, and because we're really trying to build on the live experience throughout the project. So this is a picture taken at our last review. So we had external reviewers coming to judge us, and one of them said that we are a national exemplar of how co-creation can be done well. I think we're looking at another exemplar here. So. So some of the examples of how we collaborate and co-design. So we're running a lot of different workshops. For example, you see on the side, is there a pointer? Yeah. Oh well. Like for example, we have focus groups looking about how can we collect the data together. We also have seminars also where we think about the design of things, and of course we analyze the data together. That means our people with lived experience are also co-authors on our papers, for example, and like co-applicants on grant applications. So not associate, but they're actually named applicants on it. So here's an example for this. So this was a scoping review looking at how the experience of people living with MS, how is that actually depicted in the literature. And if you look through these author list, half of them are people with lived experience who not only gave advice, but actually helped extract the data from the literature. So they became researchers with their own merit. So one tool which was generated through that project, and I don't want to take the glory for this. This is work from Jane Despra. She actually got funded through MS Australia with an incubator grant for this. Was to deliver a toolkit for collaboration between people living with MS and researchers. So how do we come to a common ground so that we want the same thing? And how do we achieve this co-design, these collaborations? And it's very similar to the pyramid, which was mentioned before. You see there's different ways to collaborate in research, and there is no ranking of this. Every kind of co-engagement is important, but there are certain different qualities. So you could either be a receiver of knowledge, or you could be a co-researcher, a participant, or an advisor. So in all of these have pros and cons, of course, but everything is important in that respect. And we can see that in a little bit in a different way, so not as a pyramid, but as a circle. But so the core thing is participation. And what this slide also includes is not only how you be involved, but what kind of support lived experience need to be feasible. No? So for example, if you're a participant in our cohort studies, what we need to think about is like, how can you access the data? How can you access us? We need to think about transfer, and we need to think about how do we transfer the knowledge we're gaining back to you. It gets a bit more complicated if you get a co-researcher. We really need to help develop your research capacity. So if you're going to be part of our program, how do you extract data from the literature or something like that? And then, of course, we need to help you through the communication system, like all these Teams and Zooms and whatever, and the background. Like we're doing a lot of research in sensor development. We need to give you a chance to get a deeper insight into the topic. And then, of course, the outer ring advisors. So being a member of the Health Experience Advisory Board, for example, there is additional upskilling in governance, which means I always find that a bit funny because, of course, everybody has a background, and many of our people with lived experience already have quite some experience with governance. So we don't need to upskill them. They already bring this with them. So I think it's also something to really remember. How are we doing with time? Okay. So I want to just switch gear a little bit. So far, that's all about Ohio and mainly Jen Despera's work because she is the lead of the health experience. So I'm just one of the many people helping. But I would like to talk also about some other more broader engagement we're doing in the ACT with our MS community. And this is something which came about when I first came to Canberra. As I said, I'm a lab rep. It's kind of embarrassing. I never have spoken to somebody with MS, but I was researching on a mouse model for MS and doing all this knowledge, And so I thought, this is terrible. I would like to know from the people I'm actually working for. So I reached out and I got in contact with Professor Robin Lucas, who's also in Canberra, and we started the ACT MS Symposium, which is now running since 2017 every year. And it's a steep learning curve. I remember the first time I didn't even think about access with walking aids or something, or that we need to move the chairs in a certain way that there's enough space, or timing. Yeah, I did the first symposium was from 9 to 5, and everybody was like, "Oh my God, this was way too much." It was great, but you're not listening you're not tailoring to your audience. So it was quite a learning curve. So what we're doing there is giving our students and early careers the opportunity to present their work, but also invite other people to give a little bit of insight what's happening at the stage in the MS research. And we invite people with MS to be co-organizers, presenters, and of course part of our discussion panel at the end. So this is going well. Full day, also similar to here, everything's free, and we get quite some good uptake with this. If I have a minute or two, I would like to talk a little bit about problems and risks. I, as a researcher, or we as a team, have experienced in these kind of inter or transdisciplinary research. Just for explaining what that is. So Disciplinary research means that it's two research disciplines coming together. Transdisciplinary is when we take in the social aspect. And so everything we're doing with people with lived experience as co-researchers is transdisciplinary. And one point we thought is really difficult, and I wanted to point out here, is language. So, and I would like to give you an example for this. So, what are you thinking when you hear the word model? Shout at me, what are you thinking? Model train, yeah. Data model, absolutely. Yes. So, you see, there is all these different ways. Like for me, a model is a mouse model. I'm working with a mouse model. So when I talk about my model, and then there's somebody sitting from the data science, they're like, what are you talking about? You don't have data. I said, no, I'm generating them, but what's the model? Like, it's very complex. And so we took on this as one of our ways to engage. And for example, what does the word personalized medicine or precision medicine actually mean? Yeah, when you go through different disciplines, it means a totally different thing. So language really is something you need to agree on, and you need to flag if you don't understand why they're using that expression. Like maybe they're not speaking the same language. Another thing we're working on, and again, this is Jane's work, is also considerations about personalized medicine, which is like the big thing in Ohio. What does that mean for people with MS? Do they actually want that or not? And yeah, I did not stop my time. How much? I'm fine. Because I would like to give you a couple of examples of our sensors. As I said, it's all about monitoring or measuring MS non-invasively, or diabetes. So this is one of our examples of a project which was basically went from idea over design to prototype in the Ohio program. This is a keto whistle. So this is an idea to measure ketones in the breath of a person or a child with diabetes. And basically, we had our young people with diabetes come together and trial all the different keto whistles already on the market, and give us input on what they liked about them, what they didn't like about them, how did that fit them, and then we published a paper with them as authors on their findings basically. So they were basically generating the data by themselves for us with this. So this is now a prototype, and hopefully will soon be available. Another one is the optical field analyzer. This is a pretty cool machine where you basically look through these little things, and a camera measures, you give signals on one eye, and the camera measures the effects on your pupil on the other eye, and that way can see if something is happening in the processing of the optical nerves. And this is highly correlated with lesions. So it's really cool. And so in Ohio, we actually brought that to the market. So in America, you can already, you wouldn't buy that, but an ophthalmologist would buy that. And we think it will help to monitor and to diagnose actually. And interestingly, in type 1 diabetes, this is also very important because eye effects are a very bad side effect of type 1 diabetes, and can be seen already in very young children, which is quite shocking. We also do a lot of other tools and apps to monitor non-invasively. For example, we have a tabbing app. We have the Sensible app. We do some sway analysis and so on. So there's lots of big data and bioinformatics going into that. And last but not least, we recently got funded from the International Progressive MS Alliance to develop an app to measure fatigue in people with MS. It's mainly tailored for progressive MS, but we also want to compare that to relapsing remitting. And at the moment, we are comparing fatigue experiences of people with MS with what we can we can get out of questionnaires. So this is led by Dr. Anne Parkinson. So we holding workshops with people with MS at the moment until end of July. And Anne and Jane told me they would be very happy to do one also for an Tasmanian cohort if you are interested. So if you're interested, either email Anne or come to me afterwards and I can bring you in contact so you can participate in Ohio. Okay, so lessons learned. Including lived experience benefits all. I think we know all of this. Communication is key, and different types of involvements need different support, and co-design needs financial and management support. We are all clear about this. So with this, thank you for your attention, and here's our general contact detail, and yeah, that's it.